You're told you have a blood abnormality and you're sent to a cancer doctor and you have no idea why. Doctor used a bunch of big words, monoclonal gammopathy of uncertain significance, and you're not sure exactly what he's talking about. That's what we need to explore. What is MGUS, monoclonal gammopathy of uncertain significance? It's not cancer. It doesn't hurt you. It won't affect your lifespan and probably will never bother you or signify anything, but it is an abnormal blood test. And it can signify the presence of an underlying blood cancer, multiple myeloma, and we have to differentiate the two and make a firm diagnosis. That's why you're sent here. It has to be taken seriously. Now, multiple myeloma would be a whole other video. I'm really doing this so that if you have MGUS, you understand the MGUS, because the vast majority of people never get multiple myeloma, but about 20% do. You're sent to a cancer doctor to make sure you have MGUS and not cancer. So MGUS is really just an abnormal blood test, that's all it is. If I grabbed 100 people at the shopping mall that were over the age of 70, I would find this abnormal protein in about 5%. They would have no idea they have it. Some doctors do a regular blood test, just regular physical exam blood test. It's called a CBC, complete blood count. The white blood cell count is your immune system. The cold virus or the flu virus or any kind of bacteria you come in contact with, your immune system mounts a response to that to fight it off. So there are many different types of white blood cell count in your immune system. They all have different functions, a lot like the Air Force has bombers, fighters, missiles. So there's a lot of different arms to your immune system. There's a particular cell in your immune system called plasma cell. It's a white blood cell, plasma cell. The job is very simple of these white blood cells. They make antibodies. Now, antibodies are just protein molecules. They actually look like a Y under the microscope. When the doctor checked your antibody levels in your blood, you were making too much of one specific type of antibody. That's the abnormality. What does it mean? It may mean nothing. It usually means nothing, but we have a name for it. Monoclonal, that means all one type. Gammopathy, antibodies of uncertain significance. Monoclonal gammopathy of uncertain significance, or MGUS. That's what you got. This protein doesn't hurt anything. It doesn't bother you. You won't feel it. It doesn't damage your organs. Here is the deal, though, with monoclonal gammopathy of uncertain significance. You may develop multiple myeloma over the years. Multiple myeloma is very simply cancer of the plasma cells, those cells that make the antibody. It actually should be called cancer of the plasma cells. You do have to get it checked at least yearly to make sure it's not growing and turning into a blood cancer, multiple myeloma. Statistically, 80% chance if you live to 100, it's never going to be a problem, but a 1 in 5 chance, 20% chance that it becomes something over the next 20 years or so. So you have to have blood work for sure, pictures of all the bones in your body. That's either done with what we call skeletal survey, 50 different x-rays of all of your bones, or the more modern way is a PET scan, because you can see all the bones at once. Also, the doctor has to look in your bone marrow. The bone marrow is an organ, it makes blood. That's where these cancerous plasma cells live if you have them. So you have to have a bone marrow biopsy. Sounds scary, but isn't. It's a simple little needle into the back of your pelvis, done under radiologic guidance or in the doctor's office. It takes the doctor about 5 minutes to do. You also need a urine test. It's not the simple urine test that the doctor has you pee in the cup. It's a 24-hour urine where you have to collect your urine in a jug for a full day. And that urine is checked to see if you're spilling protein in the urine. Once the doctor does all these tests, the blood test, the urine test, the bone test, and the bone marrow test, then he'll be able to tell you 100% you're fine, you have MGUS and not underlying cancer. But of course, the sooner you make a diagnosis of actual blood cancer, actual multiple myeloma, the sooner you can treat it and you can prevent organ damage and bone damage and kidney damage. So it makes sense to follow closely and figure out if you have it over the years. And when you come back to the doctor, you don't have to repeat all of the testing. You can just repeat what's abnormal, whether that's blood or urine or whatever. And if it's found early, if we know you're developing multiple myeloma, we have simple pills that can stop the progression. People with multiple myeloma do very well. So that's why you shouldn't panic. You got something, it sounds weird, it doesn't bother you, but it may become something, so you have to check it at least once a year. So I just wanted to make a video. I'm making it, nobody's paying me. I'm actually paying for it. There's nobody trying to sell you anything. I just want you to be able to see it, show your friends and family what you have in a calm, relaxed way. And this way, once you see it, you go back to your doctor. Now you're armed with knowledge and specific questions, and you'll get a lot more out of your visits.